the overwhelming wave, recognizing the onset of panic. It can strike suddenly, leaving you feeling helpless and out of control. Panic attacks can feel like a tidal wave, crashing over you without warning. The intensity of these episodes can be startling, making it difficult to focus on anything else. Your heart races, your chest tightens, and your breath becomes shallow and rapid. These physical symptoms can be so severe that they mimic those of a heart attack, adding to the fear and confusion. You might feel dizzy, lightheaded, or even detached from reality. This sense of disorientation can make it hard to stay grounded, further intensifying the panic. These intense physical sensations are often accompanied by overwhelming fear and a sense of impending doom. It's as if your body is on high alert, preparing for a threat that isn't actually there. It's important to remember that these feelings, however terrifying, are not dangerous. They are temporary and will pass, even though it may not feel that way in the moment. They are your body's natural fight-or-flight response to perceived threats. This response is hardwired into our biology, designed to protect us from danger. Panic attacks are common, affecting millions of people worldwide, and they are treatable. Understanding that you are not alone can be a powerful first step in managing these episodes. Recognizing the symptoms of a panic attack is the first step towards regaining control and finding relief. By identifying the signs early, you can implement strategies to mitigate the intensity. Remember, you are not alone in this. Many people have walked this path and found ways to cope and thrive despite their panic attacks. Many people experience panic attacks, and there are effective strategies to manage them. Techniques such as deep breathing, mindfulness, and grounding exercises can be incredibly helpful. In the following sections, we will explore practical techniques for coping with panic attacks, both in the moment and over the long term. These methods can empower you to take control of your mental health. With the right tools and support, you can navigate these challenging experiences and reclaim your sense of peace and well-being. Remember, recovery is a journey, and every step forward is a victory. Finding your anchor grounding techniques for immediate relief. Grounding techniques are essential tools that can help you stay connected to the present moment, especially during times of high stress or anxiety. When a panic attack strikes, it's easy to feel swept away by the intensity of your emotions and physical sensations. The overwhelming nature of these experiences can make it difficult to think clearly or focus on anything other than the anxiety itself. Grounding techniques can help you regain a sense of control by connecting you to the present moment. By focusing on your immediate environment, you can divert your mind from the distressing thoughts and sensations that accompany anxiety. One simple grounding technique is the 5-4-3-2-1 method. This method is a sensory exercise that helps you to become more aware of your surroundings and less focused on your internal turmoil. Find 5 things you can see. Look around you and identify 5 different objects. They can be anything from a piece of furniture to a tree outside your window. 4 things you can touch. Reach out and feel the textures of 4 different objects. Notice the sensation of each texture under your fingers. 3 things you can hear. Pay attention to the sounds around you. It could be the hum of a refrigerator, the chirping of birds, or the distant sound of traffic. 2 things you can smell. Take a deep breath and identify 2 distinct scents. It could be the aroma of your coffee or the scent of fresh flowers. And 1 thing you can taste. Focus on the taste in your mouth, whether it's a piece of gum, a sip of water, or the remnants of your last meal. This exercise helps to shift your focus away from your anxiety and onto your immediate surroundings. By engaging your senses, you can ground yourself in the present moment and reduce the intensity of your anxiety. Another effective grounding technique is to focus on your feet. This method is particularly useful because it involves physical sensations that are easy to access. Feel the soles of your feet on the ground, noticing the pressure and texture beneath them. Whether you're standing, sitting, or lying down, pay attention to how your feet connect with the surface. Imagine roots growing from your feet, anchoring you firmly to the earth. Visualize these roots extending deep into the ground, providing you with stability and strength. These simple yet powerful techniques can help to interrupt the cycle of panic and bring you a sense of stability. By practicing these methods regularly, you can build a toolkit of strategies to manage anxiety more effectively. Remember that finding the right grounding techniques for you may take some experimentation. Everyone is different, and what works for one person may not work for another. Try different methods and see what works best for you. You might find that a combination of techniques is most effective in helping you stay grounded. The key is to have a few go-to techniques in your arsenal that you can access quickly when you feel a panic attack coming on. With practice, these grounding techniques can become second nature, providing you with immediate relief whenever you need it. The power of breath. Mastering deep breathing for panic attacks. Deep breathing is a simple yet powerful tool that can help you regain control during moments of intense anxiety. When anxiety takes hold, our breathing often becomes shallow and rapid, further fueling the panic response. This rapid, shallow breathing can lead to hyperventilation, which exacerbates feelings of panic and can cause dizziness, lightheadedness, and even chest pain. Deep breathing exercises can help to regulate your breathing, calm your nervous system, and reduce feelings of anxiety. By focusing on your breath, you can shift your attention away from the thoughts that are causing you distress and bring yourself back to the present moment. One effective deep breathing technique is diaphragmatic breathing, also known as belly breathing. This method encourages full oxygen exchange, which can slow the heartbeat and lower or stabilize blood pressure. To practice diaphragmatic breathing, find a comfortable position and place one hand on your chest and the other on your abdomen. This helps you to feel the movement of your diaphragm as you breathe. Inhale slowly and deeply through your nose, allowing your abdomen to expand. Imagine that you are filling your belly with air rather than your chest. Exhale slowly through your mouth, gently contracting your abdomen. As you exhale, imagine that you are releasing all the tension and stress from your body. Focus on the rise and fall of your abdomen as you breathe and try to make your exhalations longer than your inhalations. This can help to activate the parasympathetic nervous system, which promotes relaxation. Practice this technique for 5 to 10 minutes each day, or whenever you feel anxious. Over time, you may find that you are able to use deep breathing to quickly calm yourself during moments of panic. With regular practice, deep breathing can become a powerful tool for managing panic attacks. It can help you to feel more in control of your body and your emotions. Remember to be patient with yourself as you learn these techniques. It can take time to develop the habit of deep breathing, especially if you are used to shallow, rapid breathing. Deep breathing might feel challenging at first, especially during a panic attack. You might find it difficult to focus on your breath or to slow your breathing down. However, with consistent practice, you'll find it becomes easier and more effective in calming your body and mind. Over time, deep breathing can become a natural response to stress, helping you to manage anxiety more effectively. Section 4. Shifting your focus. Distracting your mind during a panic attack. Distraction techniques can be incredibly helpful during a panic attack by shifting your attention away from your anxiety and onto something else. Engaging your mind in a different activity can help to interrupt the cycle of anxious thoughts and physical symptoms. One effective distraction technique is to engage in a simple mental task, such as counting backward from 100 by sevens or reciting the alphabet backward. You can also try focusing on a specific object in your surroundings and describing it in detail. Another helpful distraction technique is to listen to music, watch a funny video, or read a book. Choose activities that you find enjoyable and engaging, as this will make it easier to shift your attention away from your anxiety. Remember that the goal of distraction techniques is to provide temporary relief from the intensity of a panic attack. While they are not a long-term solution, they can be incredibly helpful in managing acute anxiety. Section 5. Challenging anxious thoughts. Cognitive behavioral therapy for panic disorder. Cognitive behavioral therapy, or CBT, is a type of therapy that has been proven effective in treating panic disorder. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. One of the core principles of CBT is that our thoughts, feelings, and behaviors are interconnected. For example, if you have a thought like, "I'm going to have a heart attack," this can trigger feelings of fear and anxiety, which can then lead to physical symptoms like a racing heart and difficulty breathing. CBT helps you to identify these negative thought patterns and challenge their validity. For example, you might ask yourself, what is the evidence for and against this thought? Or, what is a more balanced way of looking at this situation? Through CBT, you can learn to replace negative thought patterns with more realistic and helpful ones. This can help to reduce anxiety and prevent panic attacks from occurring in the first place. Section 6. The body-mind connection. Lifestyle changes for long-term management. Managing panic attacks often involves addressing the mind-body connection. Making healthy lifestyle changes can significantly impact your overall well-being and reduce the frequency and intensity of panic attacks. One crucial aspect is establishing a regular sleep schedule. Aim for 7 to 9 hours of quality sleep each night to allow your body and mind to rest and recharge. Create a relaxing bedtime routine, such as taking a warm bath or reading a book, to signal your body that it's time to wind down. Stress management techniques are also essential. Incorporate activities like yoga, meditation, or deep breathing exercises into your daily routine to help manage stress levels and promote relaxation. Find activities that you enjoy and that help you to unwind. Remember that making positive lifestyle changes takes time and effort. Start by incorporating small changes gradually and be patient with yourself. Over time, these changes can make a significant difference in your overall well-being and reduce the impact of panic attacks.